Pain relief is one of the most powerful motivators for human behavior. When we experience pain, our actions are often directed toward escaping or reducing that discomfort. But what actually shapes our perception of relief? While pain itself has been studied extensively, the mechanisms behind pain relief, especially how our brains modulate it, are less understood. This video explores new research that uncovers the neurochemical and psychological factors influencing pain relief, focusing on the roles of dopamine and opioids. We'll see how motivation, surprise, and novelty-seeking traits interact with these systems to shape our experience of relief. Endogenous modulation refers to the body's internal ability to adjust pain signals. This process involves descending pathways in the nervous system and two key neurochemical systems, opioidergic and dopaminergic. Opioids are well known for their role in pain inhibition, but dopamine is increasingly recognized for its influence on reward and motivation. Theories suggest pain is modulated to optimize protective behaviors, sometimes increased to prompt action, sometimes reduced to allow better functioning. But does this principle extend to relief? The research aims to answer this question by examining how controllability, unpredictability, and novelty-seeking affect pain relief. To investigate pain relief, researchers used a unique Wheel of Fortune gambling task. Participants received a thermal pain stimulus and could actively or passively seek relief by spinning a wheel. The task measured how active decision-making, unpredictability, and novelty-seeking influenced relief perception. In active trials, participants chose a color, and if the wheel landed on their choice, they won pain relief. Passive trials involved no choice, with outcomes determined randomly. This setup allowed scientists to compare how controllability and surprise affected pain ratings and behavioral responses, providing a window into the brain's reward and pain systems. Results showed that actively winning pain relief led to lower pain ratings compared to passively receiving relief. When participants lost, pain ratings were higher in active trials than passive ones. This suggests that controllability, being able to influence the outcome, enhances both relief and pain perception. The effect was measured using visual analog scales and behavioral tasks, confirming that motivation and engagement play a crucial role in how relief is experienced. These findings support the idea that our sense of agency can amplify the pleasure of relief and the discomfort of pain. Probe neurochemical influences. Participants received either levodopa, a dopamine precursor, naltrexone, an opioid antagonist, or placebo. Levodopa significantly enhanced the effect of active pain relief, making relief perception even stronger. In contrast, naltrexone did not show significant effects on relief modulation. This indicates that dopamine, rather than opioids, plays a central role in tuning pain relief based on information and motivation. Dopaminergic signaling appears to optimize how relief is perceived, especially when outcomes are controllable or surprising, highlighting dopamine's importance in reward-driven pain modulation. Study also examined how unpredictability, surprise affects pain relief. Using reinforcement learning models, researchers found that unexpected relief positive prediction errors led to greater pain inhibition, while unexpected pain increases negative prediction errors heightened pain perception. This effect was especially pronounced under levodopa, showing that dopamine enhances sensitivity to surprise. The more unexpected the relief, the stronger the sensation of relief. This finding aligns with theories that dopamine is crucial for processing new information and optimizing motivational responses. Individual differences matter. Participants with higher novelty-seeking scores experience greater pain relief, especially under levodopa. Novelty-seeking reflects a tendency to pursue new information and experiences, which is linked to dopamine activity. The research found a medium-sized association between novelty-seeking and relief perception, suggesting that people who crave novelty are more sensitive to informational aspects of relief. This trait may make them more responsive to motivational cues, reinforcing the role of dopamine in both personality and pain modulation. Wheel of Fortune task also tested reinforcement learning. Participants could learn which color was more likely to yield pain relief. Under placebo, most learned to choose the better option. However, both levodopa and naltrexone reduced this learning effect, suggesting that dopamine and opioids influence choice behavior differently from relief perception. This dissociation hints at complex interactions between reward systems and decision-making, with dopamine possibly promoting exploration over exploitation. Understanding these mechanisms could inform strategies for managing chronic pain and optimizing behavioral therapies. This research reveals that dopamine is a fundamental player in the modulation of pain relief, especially when relief is tied to motivation, surprise, and novelty. The findings suggest potential clinical applications, such as using dopamine-related strategies in pain management and rehabilitation. Understanding how reward learning and relief processing contribute to chronic pain could help develop prevention and treatment approaches. As science continues to unravel the interplay between motivation, neurochemistry, and pain, new avenues for optimizing behavior and well-being emerge.